Ladies and gentlemen, today we're addressing a condition affecting over 53 million American adults, roughly 1 in 5, according to the latest CDC data. That's nearly 1 in every 5 adults living with joint pain that gradually appears, often after age 50, turning everyday movements like climbing stairs or opening a jar into real struggles. But here's the truth most people don't want to hear. Arthritis isn't a sudden overnight attack. It's the result of decades of neglect, ignoring early warning signs, poor eating habits, and a sedentary lifestyle. Think of your body as a high-performance machine. Skip oil changes, tire rotations, and regular maintenance, and parts wear out. Your joints are no different. I'm not here to sell magic cures or promise relief in 1 week with turmeric water. Science doesn't work that way. Instead, I'll share the real science behind why joints hurt and, more importantly, how evidence-based lifestyle changes, smart nutrition, and consistent effort can help reduce pain, improve mobility, and support joint health. The health of your joints depends on 3 key factors: blood circulation, oxygen delivery, and waste removal. Here's something that might surprise you. Cartilage, the smooth, cushioning tissue between your bones, has no direct blood vessels. According to research from Johns Hopkins, cartilage gets its nutrition and oxygen from synovial fluid, a special lubricant inside the joint. This fluid works like a sponge system. When you move your joints, pressure squeezes old fluid and waste out of the cartilage. When you release the pressure, fresh fluid rich in oxygen and nutrients rushes back in. If you stay inactive for long periods, sitting 8 hours or more a day, the sponge never gets squeezed. Waste builds up, oxygen levels drop, and cartilage literally starts to starve. A Stanford University study found that people who sit most of the day have up to 40% higher rates of cartilage breakdown compared to those who move regularly. When waste accumulates and oxygen decreases, your body triggers inflammation as an alarm signal. Short-term inflammation protects you, but chronic inflammation becomes damaging. Chronic inflammation releases enzymes called matrix metalloproteinases, or MMPs, that literally break down the proteins, keeping your cartilage strong and flexible. The Arthritis Foundation explains that this creates an environment where healing becomes difficult. Arthritis isn't just an age disease, it's an environment disease. We can change that environment. Now let's talk about a golden remedy used for over 4,000 years and supported by modern American science: turmeric. The active compound is curcumin. Researchers at UCLA and reviews published in the Journal of Medicinal Food show curcumin is one of the most powerful natural anti-inflammatory compounds known. Your body produces pain and inflammation through an enzyme called cyclooxygenase 2, or COX-2, the same target as ibuprofen and naproxen. Curcumin naturally inhibits COX-2 activity, providing pain relief without the stomach upset or kidney strain often linked to pharmaceuticals. Studies, including comparisons referenced by Mayo Clinic sources, have shown curcumin supplements can match ibuprofen's pain relief in osteoarthritis patients with fewer side effects. Curcumin also blocks a master switch for inflammation called nuclear factor kappa B, or NF-κB, which triggers dozens of inflammatory chemicals. It acts at the cellular level rather than just masking pain. Turmeric is also packed with antioxidants that neutralize free radicals damaging cartilage cells. Research from the National Institutes of Health indicates curcumin's antioxidant power is 5 to 8 times stronger than vitamin C or E. The challenge? Curcumin has poor absorption on its own. The solution is black pepper. Piperine in black pepper can increase curcumin absorption by up to 2,000%, according to studies in Planta Medica. Practical daily method? Mix 1 teaspoon of turmeric powder with a pinch, 1/4 teaspoon, of black pepper into warm water, milk, or tea. Drink twice daily with meals. Or grate 1 inch of fresh turmeric root into your cooking. Consistency matters. Benefits typically appear after 8 to 12 weeks of daily use. One-time use won't create miracles. Always start slowly and consult your doctor. Next is ginger, turmeric's powerful cousin. Research published in Arthritis and Rheumatology shows ginger is particularly effective for osteoarthritis. Ginger contains gingerols and shogaols that block inflammatory pathways and improve blood circulation to joints. A University of Miami study found ginger extract reduced knee pain by about 40% in just 6 weeks. Ginger also acts as a natural blood thinner, enhancing microcirculation, the tiny vessels around joints. This means more oxygen and nutrients reach cartilage and waste is removed faster, supporting the sponge mechanism we discussed. Fresh ginger root is best because it retains higher levels of active compounds. Daily method: grate 1 inch of fresh ginger, steep in hot water for 10 minutes to make tea, drink 2 to 3 cups daily. Add grated ginger to smoothies, stir-fries, or salads. Harvard Medical School research suggests combining ginger with turmeric creates a synergistic effect that works better together than separately. Garlic offers surprising joint-specific benefits most people overlook. It contains a sulfur compound called diallyl disulfide. Research from King's College London, published in BMC Musculoskeletal Disorders, shows this compound inhibits enzymes that destroy cartilage matrix. Think of it as building a protective shield around your joint cushioning. A Cornell University study found aged garlic extract reduced markers of inflammation like C-reactive protein by 35% in arthritis patients. Garlic's sulfur compounds also help maintain flexibility in connective tissues around joints. For maximum benefit, use raw garlic to preserve allicin, the key active compound. Cooking destroys up to 90% of allicin. Daily method: crush 2 to 3 raw cloves, let them sit for 10 minutes to activate allicin, then mix with honey or add to salads. If the taste is too strong, aged garlic supplements are a good alternative. Consistency is key for results. Aloe vera has been used for over 4,000 years and is now recognized by American Research for joint support. The University of Maryland Medical Center notes aloe vera contains over 75 active compounds beneficial for joints. One key polysaccharide, acemanin, can reduce inflammatory cytokines by 30 to 40%, according to studies in the Journal of Research in Medical Sciences. It helps rebalance immune cells. Aloe vera also contains salicylic acid, the same compound in aspirin, which blocks COX-2 without stomach irritation. A University of Miami School of Medicine study on osteoarthritis patients showed daily aloe vera gel, 2 ounces, reduced pain by 35%, improved mobility by 25%, and decreased morning stiffness by 40% over 8 weeks. For internal use, drink 2 to 4 ounces of pure inner leaf aloe vera juice daily on an empty stomach. Choose IASC certified brands like Lily of the Desert or George's. Avoid whole leaf products due to laxative effects. Start low and increase gradually. For external use, apply 100% pure gel to joints. Massage gently 10 to 15 minutes, 2 to 3 times daily.
Without movement, no amount of turmeric, ginger, garlic, or aloe vera will fully help your joints. Why? The synovial fluid sponge mechanism only works when you create pressure through motion. A large CDC study tracking over 10,000 arthritis patients for 5 years showed those who changed diet alone saw about 15% improvement. Exercise alone gave 40% improvement. Combining both delivered up to 70% better outcomes. Science is clear. Movement is non-negotiable. We're not talking marathons or high-intensity workouts. Focus on low-impact activities that pump synovial fluid without stressing joints. Start with 5 to 10 minutes daily and build up. Consistency beats intensity. For knee arthritis, the most common, try seated knee extensions. Sit in a chair with back straight. Slowly extend one leg straight out. Hold 5 seconds, lower slowly. Do 10 reps per leg. This pumps fluid without impact stress. Another great knee exercise, wall squats. Stand with back against a wall. Slide down until knees are at about 45 degrees, not a full squat. Hold 10 seconds, then slide back up. Repeat 5 to 10 times. This strengthens supporting muscles and reduces joint load. American College of Rheumatology research showed these exercises increased knee cartilage thickness by about 8% over 6 months. For hands and wrists, try wrist circles. Extend arms forward, make fists, rotate wrists 10 times clockwise and 10 counterclockwise. This lubricates wrist joints and reduces morning stiffness. Finger walks. Place palm flat on a table. Lift and walk each finger forward and back. Do 5 minutes daily. This maintains finger joint mobility and flexibility. For hip arthritis, hip flexor stretch. Stand near a wall for support. Step 1 foot back, gently push hips forward. Hold 30 seconds per side. This reduces compression on hip joints. The golden rule? Start with 5-10 minutes daily. Increase gradually. Move every day. Even short sessions help pump synovial fluid and build muscle support around joints. Several nutrient deficiencies directly worsen arthritis. Nearly half of Americans have low vitamin D, per NIH reports. Vitamin D regulates calcium absorption and cartilage health. Harvard research found people with vitamin D levels below 20 nanograms per milliliter have 3 times higher cartilage loss rates. Get tested. Aim for 30-50 nanograms per milliliter. Supplement 2,000 to 4,000 IU daily after testing, plus 15 to 20 minutes of sunlight without sunscreen most days. Omega-3 fatty acids reduce joint pain by an average of 30%, according to meta-analyses. Best sources, wild-caught salmon, 2 to 3 servings weekly, walnuts, quarter cup daily, ground flax seeds, 2 tablespoons daily. Consider fish oil providing 1,000 to 2,000 milligrams EPA/DHA daily. Magnesium deficiency increases inflammation markers. Eat spinach, almonds, black beans. Supplement 300 to 400 milligrams daily with dinner. Certain foods actively damage joints. The American Heart Association recommends no more than 25 grams sugar daily for women and 36 grams for men, but average Americans consume 77 grams. Excess sugar triggers cytokine release, inflammatory chemicals attacking cartilage. A University of Colorado study showed people consuming over 100 grams sugar daily had 50% higher inflammation markers. Cut soda, fruit juices, pastries, cookies, candy, sweetened yogurt. Trans fats in fried foods and processed snacks increase arthritis severity, per Mayo Clinic research. Avoid fast food, packaged baked goods, margarine. Excess sodium causes fluid retention and joint swelling. CDC recommends under 2,300 milligrams daily, but average intake is 3,400 milligrams. Reduce processed foods and restaurant meals. Massage therapy is an ancient remedy, proven highly effective by modern science. A Yale School of Medicine study found regular massage reduced pain by 40-50% and morning stiffness by 60% over 8 weeks, while improving circulation by 40%. When massaging joints, 3 things happen: mechanical pumping of synovial fluid, just like exercise, gate control theory blocking pain signals, Harvard Medical School, and endorphin release, your body's natural painkillers, NIH. Olive oil contains oleocanthal, which works like ibuprofen. 3 to 4 tablespoons equal a 10% ibuprofen dose, without side effects. Mustard oil dilates blood vessels for warmth and stiffness relief. Sesame oils, sesamol and sesamin, provide strong antioxidant protection for cartilage. Here's the exact Yale-recommended 15-20-minute technique.
Warm oil slightly above body temperature. Test on wrist. For knees, 1 to 2 tablespoons oil. Phase 1, 3 minutes. Light circular motions around joint. Pressure level 2 out of 10. Phase 2, 7 minutes. Deeper circular motions. Pressure 5 to 6 out of 10. Thumbs making circles above and below kneecap. Always stroke toward heart. Phase 3, 5 minutes. Gently knead surrounding muscles. Phase 4, 3 minutes. Light cooling circles. Pressure level 2 out of 10. Total time 15 to 20 minutes. Do 2 to 3 times daily for severe pain, once daily for maintenance. Use after shower when pores are open. After massage, pores stay open and circulation increases. Sudden cold can cause muscle spasms. Avoid cold showers, direct AC/fan, going outside in cold, or cold drinks for 45-60 minutes. Wrap joint lightly, keep room at 68 degrees Fahrenheit, rest 15 to 20 minutes, drink room temperature water. American Massage Therapy Association research shows following these precautions improves results by 50%. Avoid massage during acute swelling, skin infection, fever, recent surgery, wait 6 weeks, or rheumatoid arthritis flare-ups. Consult doctor first. Sample daily routine. Morning, warm water with 1 teaspoon turmeric plus black pepper pinch. Breakfast with omega-3 source, walnuts, flax. 10 minutes gentle stretching. Lunch, leafy greens, grilled salmon or beans. Midday, 2 raw garlic cloves, crushed, rested 10 minutes, with apple or honey. Afternoon, fresh ginger tea. 15-minute walk. Dinner, anti-inflammatory plate with vegetables, lean protein, olive oil. Evening, hand and knee mobility exercises. Supplements, vitamin D, omega-3, magnesium as tested. Weekly track pain, 1 to 10 scale, mobility, energy. Studies show noticeable improvements in 8 to 12 weeks with consistency. Stanford behavioral research found 92% of health changes fail within 6 months due to unrealistic expectations. Start small, 1 or 2 changes per week. Week 1 to 2, minor stiffness reduction. Week 8 to 12, noticeable pain drop. After 12 weeks, major mobility gains. It took decades to develop arthritis. Give healing months, not weeks. People who track progress daily, share goals, and celebrate small wins have 65% higher success rates. The CDC estimates arthritis costs Americans over $300 billion yearly in medical expenses and lost productivity. Most of this is preventable. Your body has remarkable healing ability. Give it proper nutrition, consistent movement, and time to repair. This isn't about becoming an athlete. It's about reclaiming your freedom, playing with grandchildren, traveling, living without constant pain. The science is clear. The path is proven. The choice is yours. Start small today. Start now. You've got this. This video is for educational purposes only and is not medical advice. If this helped you, please give it a thumbs up, subscribe, and hit the bell icon. Share it with someone who's struggling with joint pain. You might change their life. Thanks for watching.